Hi there, everyone. My name is Brandon Gibbons, and today I'm going to be presenting you with Bloodborne Pathogen safety training. So, at the end of the Bloodborne Pathogen training session, students should be able to do the following: produce a definition of bloodborne pathogens, recognize which members of the workforce are at risk of exposure to bloodborne pathogens, identify at least one disease that is transmitted through bloodborne pathogen contact, identify critical aspects of a bloodborne pathogen exposure control plan, summarize means of controlling exposure to bloodborne pathogens, indicate methods of disposal for blood and bodily fluids, provide steps necessary when exposed to a bloodborne pathogen. As an introduction, I'm just going to give you guys a statistic real quick. So 5.6 million workers are at risk of occupational exposure. This includes healthcare workers, so your doctors, nurses, physicians, people behind the counter at the pharmacy, first responders, housekeeping staff. We have maintenance and waste workers, correctional healthcare workers. So, for an idea as to what kind of diseases can be transmitted through bloodborne pathogens, the HIV, Ebola, and Zika viruses can spread through contact or exposure due to infected blood or bodily fluid contact. So, bloodborne pathogens are infectious microorganisms in human blood that can cause disease through the exposure process. Some examples of bloodborne pathogens besides HIV, Ebola, and Zika are hepatitis B and hepatitis C, and both hepatitis B and C lead to serious liver disease. In hepatitis B, I believe over 70% of the patients develop chronic liver disease and scarring on their livers. So, HIV, or the human immunodeficiency virus, as we know, leads to acquired immunodeficiency syndrome, or AIDS, which repeatedly attacks cells in the human immune system until it is eventually destroyed entirely. So, bloodborne pathogens can be introduced to the body through exposure from direct contact, indirect contact, respiratory transmission, or vector-borne transmission, such as bug bites. Injuries causing any loss of blood can expose individuals to bloodborne pathogens. If someone cuts their hand, gets a paper cut, cardboard cut, head wounds, especially anything that bleeds, all a risk for exposure to bloodborne pathogens. Exposure control plans are documented plans to eliminate or minimize exposures, and these exposure control plans should be a part of every employer's policies and staff and employees should have access to the exposure control plan at their viewing pleasure. Some required sections that must be included in exposure control plans are the exposure determination, so determining what kind of exposure is going on. Is it something really serious? Is there a lot of blood? Is there a lot of bodily fluids? The next element that should be included in the ECP or exposure control plan is schedule and methods of implementation. And then we have the procedure for evaluation of exposure incident. Then we have post-exposure follow-up, and the exposure control plan should be annually updated, and the policy should be reviewed each year as well. This is especially the case if your employer maybe puts you in more of a situation where you are exposed to a bloodborne pathogen risk more often. All of that should be documented and kept on file. Some more things that the ECP or exposure control plan must include are safe management of a bloodborne pathogen situation or any sort of situation involving blood, bodily fluids, or anything of that matter. So you want to also make sure that there's tracking and documentation going on with any sort of situation involving blood or bodily fluids. You want to make sure that you're documenting the whole process, what happened, what areas, human and non-human, were affected with exposure, and how to handle the cleanup process and the follow-up, for instance. So you want to make sure that the exposure control plan also has a sharps disposal element or section. So anytime that you're dealing with sharps, please never pick them up with your hands. It's a terrible idea, but they should go in a biohazard labeled sharps container like this, which we'll talk a little bit more about later. You want to make sure that standard precautions are part of the exposure control plan as an employer. Hygiene practices, washing soap and water affected areas. PPE or personal protective equipment usage, what may be required in your field or occupation. I worked at a job where I saw people clean up blood with just gloves on, but it's different for where people work. Risk reduction methods should be included in the exposure control plan. Decontamination process, the handling of laundry, is important if you come into contact with any blood. And then you want to make sure that your sharps injury log is being kept up to date. That is very important. You want to also talk about the hepatitis B vaccination in your ECP as an employer. It's a very important vaccine that can prevent a horrible, horrible disease. It's very important. You want to also make sure that the exposure control plan indicates hazard communication and methods of dealing with these sort of hazards. So, all blood and bodily fluids must be treated as if they are contaminated and require proper decontamination cleanup methods. No matter if you think someone does not have a bloodborne pathogen that they could spread to you or not, each case should be handled like you're being exposed to a bloodborne pathogen. And there are proper steps to decontaminate whatever area has affected your body or whatever environment you're working in. So, ways of controlling exposure are through improvements in medical devices, sharps disposal containers such as this guy right here, hand hygiene, which is a necessary work process to control exposure. There should be some sort of available and provided personal protective equipment or PPE, which should be worn at all times. And I think this is just based on whatever organization you work for, but there should be some PPE available to anyone who must deal with a bloodborne pathogen spill. So, PPE includes gloves, masks, gowns, aprons, smocks, face shields, mouthpieces, safety glasses, CPR pocket masks. Depending on what kind of situation you're dealing with, you should wear less or more, I'm sure. But I would think that I would want to be as protected as I could in any sort of situation involving bloodborne pathogens. So, if you ever come across a broken syringe or used needle, as I said earlier, just don't touch them with your bare hands. You want to use like tongs, sweep them up or something, and they should always go in a biohazard labeled sharps container like this. Very important. You don't want to risk picking up a needle and poking yourself with it or cutting yourself with broken glass and horrible situations. Don't do that. So, the way to dispose of blood and bodily fluids is in closable, leak-proof, biohazard labeled bags or containers. I actually did try and get some leak-proof or biohazard labeled bags for blood or bodily fluids, I was not able to. Unfortunately, I could not get anything through the pharmacy or the Hilton medical equipment provider, so yeah. Otherwise, I would have presented you guys with those on camera here. So, in the event of an exposure to blood or bodily fluids, the exposed area must be washed with soap and water. You should flush your nose, mouth, splashes of water, and you should also irrigate your eyes if you have an eye rinse station at your work, or use like a saline rinse. If you don't have an eye wash station, just splash water in your eyes. You want to report the exposure to your supervisor as soon as possible. Post-exposure treatment may be necessary. And this is how you determine if it's necessary. You want to make sure your supervisor knows. So the employer must provide documentation of the incident with the routes and circumstances of the exposure incident. So to conclude here, bloodborne pathogens put all of us at risk and should be handled seriously with precaution. Exposure occurs in numerous direct and indirect ways. Exposure control plans must be put in place in order to minimize or eliminate exposure. Cleanup of blood or bodily fluids must follow waste disposal guidelines, safe handling procedures, and decontamination. Effective measures of controlling exposure must take place, such as washing the isolated area, isolating contaminated laundry, and placing sharps in designated containers, which we talked about earlier. PPE is essential and must be worn all times when handling blood or bodily fluids. And the proper decontamination steps must be taken for individual and areas affected. You should report the exposure to your supervisor and follow up with written and recorded documentation. So yeah, this is my presentation on bloodborne pathogen training. Just to give you guys some references here. So I got all this information from CDC articles, a American Red Cross article on preventing the spread of bloodborne pathogens, an exposure article from MedCorps, and an OSHA bloodborne pathogen hazard article. Yeah, I hope you guys found that helpful, and have a great day.